My experiences with my preceptors have been absolutely amazing. I've been in quite a few different settings, in an inpatient setting at a hospital, in outpatient internal medicine office, as well as a women's health OB/GYN office as well. My preceptors have shown me to do practically everything. They've really made my learning experience come to life, essentially, in the clinical setting. So everything from communicating with patients and building trust and rapport with your patients, I've learned, as well as clinical technique and how to perfect my physical exam findings and my physical exam technique.
In each place I was working one-on-one with either a nurse practitioner or a physician who really kind of mentored me and helped to encourage me as I learned about specific conditions as well as taking care of patients over the spectrum of their adult lifetime, and encouraged me to be an independent provider and really take the best possible care of patients.
What my preceptors usually tell us, I believe, is that you have to, sometimes even if it takes you walking out of the room for a few minutes, excusing yourself, gather yourself and know that whatever happens in the room, it's more than likely not about you. It's more about the patient and their situation, where they find themselves. Before I came to Columbia, I was an opera singer. Bringing my performance experience to nursing, the best skill that was reinforced was the ability to listen. Sometimes you want to say something to the patient, and you want to maybe lend advice, and sometimes the best thing is to just listen, because you'll get a lot of information if you just listen.
Obviously, our preceptors play a big role in our education, with our hands-on, technical skills that we're, would be utilizing as an RN day to day. We're learning things like, in my community rotation, I worked with children who had permanent G tubes that had to be fed through those. I learned how to work with those and manage them in their feedings. Learned about giving vaccinations, to some of these children. Things like, the simple day-to-day things that nurses do, checking vital signs, doing a physical assessment on your patient, listening to their heart, listening to their lungs, and knowing what you're listening for. All of these technical skills that a nurse needs to have, our preceptors play a huge role in, kind of instructing us with those. Since working with these preceptors, my level of confidence and just my general comfort in working with these patients has definitely, increased. I think, another great thing that our preceptors provide for us is just being role models. Like, most of these women they're working RNs. A lot of them are mothers, that have children at home. A lot of them are going back to school and furthering their own educations right now, getting masters, getting doctorates, PhDs, and, kind of just seeing that they're able to sort of juggle all these things and still, come to work every day and, kind of have that compassion with their patients and, be excellent nurses.
We had a patient on our floor who was quite ill. She had a gastrointestinal infection that was really hard to manage. And her two daughters, adult daughters, were there, and they were clearly very concerned for their mother's welfare. And early on, they were just really involved and a little overwhelmed by everything that was going on, really questioning everything that the nurses were doing, and kind of unhappy with sort of not knowing all the answers to what was going on. And my preceptor was just so great at communicating with them and helping me get involved in that communication, enough so that I took my time to explain what I was doing to the patient's children, and over the course of a few days really gained their trust to the point where when I came back in for future shifts, they were asking me, "Are you going to be with our mom today? Like, we were glad to see you." I really built a rapport with them, and it was really through my preceptor that I kind of learned how to communicate in a way that really made family members feel comfortable and confident in, like, the nursing care that our patient was getting.